Welcome to episode 209 of the Pharmacist Voice podcast. I'm the host, Kim Newlove. CAPT Marisol Martinez joins me today to talk about her experience in the Public Health Service Commissioned Corps. She has been in the Corps for 17 years, and she's currently serving a non-traditional pharmacist role with the CDC. If you're a pharmacist or a pharmacy student exploring your career options, you need to listen to this episode. And if you're new to the Pharmacist Voice podcast, welcome! Again, my name is Kim Newlove, and I'm the host. I'm a pharmacist by training, but I'm not in clinical practice anymore. I made a career transition to voice actor and podcast host. Among other things, I narrate audiobooks for women pharmacist authors, provide medical narration to clients in the pharmaceutical, biotech, and continuing medical education industries, and I narrate content for explainer videos and e-learning projects. I was inspired by my nonverbal son, who has autism, to combine my background as a pharmacist with my speaking voice and launch my business, The Pharmacist Voice, in 2017. My son Craig helped me realize the power of having a voice and using it. My solo podcast episodes are about some aspect of being a pharmacist, a voice actor, a pharmacist podcaster, or my career transition from pharmacist to voice actor and podcast host. My interview shows feature a variety of people who use their voices to advocate for something like public health, educate in some way, or entertain so that you are inspired to use your voice too. This is episode 209, and you can find the show notes on my website, thepharmacistvoice.com. Just click on the podcast tab and search for episode 209. Without further ado, here's my conversation with CAPT Marisol Martinez. Welcome to the Pharmacist Voice podcast. I am happy to have you here today. Welcome.
Thank you, Kim. I'm glad to be here.
Awesome. Now, I have never spoken to anyone who works for the CDC. This is exciting for me. I can't wait to hear how you got from pharmacy school to the CDC. Can you fill me in?
Sure. I went to pharmacy school at the University of Houston in Houston, Texas, and we had one of our deans was a retired public health service captain. And so he always talked about his job with the Indian Health Service, helping the underserved, the population he helped. And I was always very interested in that. He said also that if we were interested in public health, then it would be a good idea if we looked into one of the rotations we had in Sitka, Alaska, and with the Indian Health Service. It was Mount Edgecombe Hospital in Sitka. And it just so happened that I had in college done a summer job with the Department of the Interior. I was a park ranger in Skagway, Alaska, and had the best time of my life in Alaska for a summer. And so I after that trip, I just really wanted to go back. And so when I learned that our school had 2 spots open for Alaska for rotation, and, this dean had me interested in Indian health and public health service, I knew it was something I wanted. So I kind of bugged him my first year, second year, and third year. And finally he said, yeah, you can, seems like you're very interested. You can have this, one of the slots there in Sitka. So I've got to spend a summer helping the Alaska Native population there and in Sitka. And it was a really wonderful experience. And I got to see a whole different side of pharmacy that I had never seen before. And so I really liked how you got to spend time with the patient and really see what you did, live, like the good that you were doing in this person's life live right in front of you. And so it was an experience I'll never forget. And so when I was close to graduating pharmacy school, I applied to the Commission Corps. And I think the process for hiring is a lot better now than it was in 2005. But I basically had to go and find my job, which is what everybody has to do. But I went to Santa Fe Indian Hospital and asked if I could have a job. And they said, oh, we do have some openings. And that's how I started in Santa Fe with the Indian Health Service. And I stayed there for nearly 4 years. And a job came open to work with the Department of Defense with formulary management, which is what I do now, with TRICARE, which is the military's benefit, the public health service benefit as well. And so after spending nearly 4 years in Santa Fe, I got the job and I moved to San Antonio, Texas, which is where I'm from as well. And for 7 years, worked with TRICARE, worked with the Formulary Management Branch, and really learned about how to administer a pharmacy benefit on a very large scale and how to work with a federal health benefit. At the time, I think in the public health service, there are very few of us doing formulary management. And so through connections and through people like you meet at different pharmacy meetings and people knowing what you do, somebody from CDC, from the World Trade Center Health Program, reached out to me and asked if I could talk about what I do and if I could help, in any way with what they were doing with the World Trade Center Health Program. And so I invited that person to our San Antonio PNT meeting. And I, asked if there were the openings available. And she had said yes. I applied and interviewed and got the job. And so after 7 years in TRICARE, I moved to Atlanta to work with the CDC, because that's where the World Trade Center Health Program is. And so I've been working for this program for a little over 6 years now. And so that's kind of the way I got into PHS and then somehow found my way to CDC. And I'm really happy. I've been really happy with the agency and my program. And I never would have thought when I first started that I would end up at CDC like I have. Just kind of goes that way sometimes.
That's quite a story. I'm kind of curious about this World Trade Center formulary management and all that. What exactly do you do?
Sure. The World Trade Center Health Program is within CDC, within the National Institute for Occupational Safety and Health. And it's a program that was put into place by the Zadroga Act in 2011. President Obama signed that, which gave support to our clinics and the nationwide provider network so that we could treat survivors and responders of 9/11. And so they get a medical benefit and they get a pharmacy benefit. They get monitoring as well. For my job on the pharmacy side, we make sure we have the medications available that treat the certifications we certify for. So we only certify for certain diseases that are linked to the exposures from 9/11. So if you are working in the area or living in the area and you are exposed and you have a disease, we can certify for certain diseases and then give you medications to treat those diseases. And sometimes those medications will have criteria for use or prior authorizations or quantity limits, all those things involved with formulary management. And so that's what the program is. And I think we have over 112,000 members, some in active treatment, some not. So it's a smaller program compared to, TRICARE where I worked, where we had millions of beneficiaries. But I like that it's a smaller program because I think we're a lot more agile and flexible with how we cover treatments, especially with our specialized population and their exposure, an exposure that's unlike anything else. So I feel very fortunate to be able to do what I do and know that my work every day, I know who it affects and the impact it has on their health.
It sounds like you get to flex your professional muscles, your pharmacy muscles, so to speak. Would you agree with that?
You really do. You really do. You have to take a lot into consideration when you're looking at different ways to cover medication and how it fits your population and what you'll accept as in the medical literature for, coverage of certain therapies and what you won't.
if you're dealing with something that's unlike anybody else has to deal with, I would feel like you would have to educate yourself or reach out to the experts in the field to find out what exactly your role is supposed to be. You know about medications, but how exactly to help those patients? I almost feel like it's what do you call it? Uncharted territory, and you get to invent the solution. You have to be a problem solver in situations where it's the final frontier. Nobody's gone there before. You know what I mean?
Right. Exactly.
I'm sure that problem solving skills would be important. Do you work remotely or do you work in person with your patients?
I don't ever see these our members in person. At the very beginning, we would hold town halls, and I remember going to one in Orlando and actually meeting some of our members and answering their questions firsthand. And but we don't necessarily see the people that we are serving. Occasionally, we'll make a call, if there's an outstanding issue, and we might be able to talk to a member or help them, in extenuating circumstances, get medications. But overall, we're kind of behind the scenes.
When you first went to pharmacy school, what did you think you would do when you graduated?
I thought I would be a compounding pharmacist because I really thought that was really interesting. And I liked how you could make something, specialized for one patient, and that would help them when nothing else would. But because I went to that rotation with Indian Health and Sitka, that just changed my trajectory. And that's how I've kind of lived my career. Like, if there's an opportunity that I don't know about or I'd like to learn more about, I gravitate toward that. I gravitated to the job in with TRICARE in San Antonio, and then that kind of set me on a career path where I've continued to do the same kind of work but for a different benefit. And who knows what will happen next, or what I'll do after I retire out of the Corps. I'm always open to those new opportunities, though, because I've never had a bad experience with any of the choices I've kind of made, thus far.
Yeah, I went back to that pharmacy school experience because sometimes what people think they want to do and what they end up doing are two very different things, which is definitely the case with you. But I can tell you're a gap filler type of a person. Put me where you need me. I'll do a good job for you.
Oh, absolutely. I think it's the most fun part about my career so far. I'll fill any gap. And because you get to learn something new, you learn something new about yourself too, and your capabilities, and you're just building upon your skills and your skill sets, and makes you hopefully more marketable in the future if you kind of do and excel at different in different areas.
Yes, you can be more marketable if you have a broader depth of experience, which
Right.
brings me to my next question. You're right now doing what you're doing in Atlanta, but what's next for you?
What's next? I can see myself staying in this program, and maybe even getting into the research side of this program. There's a whole other side to world trade where we solicit for research with our patient population. And something that we're looking into now is soliciting for pharmacy-based research ideas. And I've kind of been dabbling in that. And I could see myself doing more of that if I stay with the program. That's something I would be interested in because it's a different way to use your pharmacy skills and your pharmacy experience in creating, subject matter to research. So that's something I'm doing a little bit now. I'm still very much into formulary management, but I think soon I can get more into the research side of this program. And that's something I would like to do.
Go for it. I encourage you. And then come back on the show and tell me how it went.
Sure. Sure.
That's exciting that you have all these opportunities and that you, even after 17 years in the program, you still have the ambition to do something different. That's great.
Correct. I have been in 17 years, and especially at CDC, you see what all the different pharmacists do here. There's not many. I think there's about 40 pharmacists in CDC overall. And they all do something very unique. And I just know that the opportunities are out there. And, if and when I'm ready for a new opportunity, I know that if I want to stay with CDC, there are a lot of options within this agency to continue on with in public health.
Speaking of continuing on, do you have a certain retirement date? I mean, 17 years. I've heard that 20 is retirement service age. So what are your thoughts on retiring?
It's nice to know that at 20 years, if I wanted to leave the Corps and start a new career, that's possible. And even though it's 3 years away, I still don't know what I'm going to do, if I will continue to stay in with the Corps. And that's a really good question. And I actually ask myself daily, what am I going to do after 20? And I don't have an answer for myself just yet.
That's all right. I'll stay tuned. That's one of the great things about being a podcaster. I can network with people, meet them, and then follow up. And 3 years later say, so what did you end up doing?
Right. Now, please ask me in 3 years.
Yeah, I plan to. And Stephanie Bagansky, when she was on, she was talking about how she doesn't know what she's going to do when she hits 20 years. So you're not alone.
Okay, good.
It seems like a common feeling. And that's all right. All right. Now, I understand that you are not just a pharmacist, but you're a pharmacist mom. So can you tell me a little bit about your family?
Sure. Right now, I have a nearly 13-year-old son and a 15-year-old daughter. And they are interested in their own things, not necessarily health or pharmacy or anything, which I think is good that they follow their hearts with what they want to do. But they're really, as they get older, they're really supportive of me, because sometimes I have to go on deployment for a month. The older they get, the more supportive and wonderful they are about me going. And they just, as long as you're helping people, Mom, is what they say, then we support you. And then my husband, David, is an incredible support as well. And I know a lot of people don't have this, but he's a stay-at-home parent, which I think has been really helpful with me in following my career and being able to go on deployments, knowing that, our family life is going to stay intact and nothing's going to change besides me being gone. But he's the biggest support, I'd say, in being able to have a good work-life balance. And now that I'm home, it's just a different dynamic, because they, they're here when I'm here. They're actually in a hybrid homeschool. So I get to see them a lot. And I just really love that we're in the same space together in the moment. I don't know how long that will last, but it's really great to have them here and see them and help them with homework when I can. And while, I'm here doing my work too.
Much respect to your husband, Dave. Not everybody's that lucky to have a stay-at-home parent, to co-parent with. So much respect. I think your family dynamic sounds awesome. Glad to hear that you're supported. But I do want to ask about these deployments. What's a deployment like for you?
Deployments for me really got kicked off with the beginning of COVID back in 2020. In March of 2020, I went to the San Francisco quarantine station at their international airport for a month. And so we were in charge of kind of interviewing passengers after they got off their international flights to make sure they were feeling okay, taking temperatures. Also around that time, California was shut down, was shutting down. So we were also kind of educating them, on as they were coming in, giving them the news that they needed to kind of stay home, and sometimes we were the first people to tell them that. So it was a really interesting time to be working with the CDC at a quarantine station, working with, other agencies as well, like Customs and Border Patrol, and working with the quarantine station staff as well. But, as hectic and stressful as it was really good experience. It's something also that I was using very little of my pharmacy skills for. There were some times where I need to ask about medications somebody was taking, or um, I could clarify questions in terms of medication use, but it was really like using your people skills, using your management skills, your leadership skills, your communication skills, so that we could get our mission done there in San Francisco. Um, so that was about 30 days away. And it was overall a really great experience. And there are many missions like that around the nation at really busy international airports.
Thank you for sharing that. And thank you for the important work that you do. Are there any other deployments that you'd like to share about?
Sure. So there were a lot of CDC remote deployments that I was involved with. And again, some at the very beginning where we were actually getting ready and planning for the release of the first vaccines. And so we worked with retail pharmacies to help create plans for distribution. And we helped create plans for how we were going to track the doses of the vaccines. So that it was really exciting to be part of this effort early on before we even had our first vaccines out. And then when they did come out, I did deployments with our CDC occupational health clinic where we were vaccinating CDC employees for a month. At least I was on deployment for that mission for a month. Just working with CDC, you can get pulled into so many different activities and efforts. It was really a great learning experience. And again, just thankful that I could be a part of that. So we were giving vaccines, we were answering questions from the public about, how to treat patients and how to, recommendations on which soaps to use, and just any question about COVID you could send to the CDC, we answered. So it was a really wonderful time, a busy time. It was, again, just really grateful to be a part of it.
It sounds like you were fighting medical misinformation at times, right?
Yeah, that's true as well. We had to be very careful of how we answered questions and made sure we used CDC language so that we wouldn't get misinterpreted, or that information that we emailed back wouldn't get forwarded. And so we just had to be very careful of how we answered questions and made sure the right information was in there that could be backed up by the resources we had on our CDC site.
That's so important to get the right information out there, especially in the early days. There were so many people speculating about what will help and what spreads the germs and whatnot. And it's nice when there's a go-to resource who's putting out the correct information. Yeah, thanks for the important work you do.
Thank you.
Well, that wraps it up for deployments. Let's talk about a little different question. You have had a great experience. You've talked about your 17-year career in the uniformed service, the Public Health Service Commissioned Corps. Would you recommend this as a career option for other pharmacists?
I would recommend joining the Public Health Service if you are looking for opportunities to act in a public health role and act on behalf of a commission corps whose mission is to protect, promote, and advance the health and safety of our nation. So you're really acting as something bigger than yourself when that's your mission, and your mission is to help the underserved. And it is a very different career path than a traditional pharmacist role. And I can see how people on both sides love their work. So it is a departure from a retail or a hospital pharmacy job. Even though we do similar things in the public health service, I think it's the populations we serve, the underserved populations, that really can bring you a sense of achievement and a sense of that you're doing something good for the world.
Agree. Yes, you make a great impact on public health in the United States. I know I keep saying thank you for the important work you do, but you guys are saving the world.
Thanks for your support.
You're welcome. You're welcome. Now, we talked about what you would recommend, for other pharmacists coming into the picture and joining the public health service. But I have this general question. Do you have any advice in general for pharmacists out there, just as a seasoned pharmacist?
if you're interested in public health and you're trying to apply to these jobs in public health, I think it's important that you're working somehow and like you're picking a public health project if you can, something that improves public health outcomes, whether you're volunteering at community-based health education programs or health events, or any way that you can take health and health education to your community in a way that helps them learn is a great kind of stepping stone to being a public health pharmacist. That's if you're a current pharmacist or you're a new graduate, or if you're even in school thinking about this kind of career. I mean, it could be anything like water, sanitation, or food, nutrition. Even literacy is important, especially women's literacy, to get involved in. One of the most determining factors linked to women's health is the actual ability to read and to write. And so that's why that's important. And there's just so many things you can do in public health to make a difference. But if you're in school, try to do some research in public health, be leaders in your school pharmacy organizations, do some public speaking outside your school assignments and rotations. And I'm saying that because I do review student applications for rotations with the CDC, and those are the things we look for. So whether you're currently practicing or you're a new grad, or in school currently, think about doing those things so that you'll be noticed when somebody's looking for a public health pharmacist.
That's great advice. Yeah. And plus, if a student or a pharmacist just in general tries to do a public health initiative where they're educating somebody about public health topics and they decide, hey, you know what, I don't think I like this. You've actually saved them from joining, the public health service.
Right.
Not that it's not a great organization, but seriously, if they do not like it, then you're saving them from joining something that they don't really want to be part of.
Sure. It's just kind of dipping your toes into public health and seeing if that's what you're interested or what you're passionate about. No harm in trying out things before you take the leap.
Excellent points. Marisol, what is one of the biggest challenges you face as a public health service pharmacist?
I think there are some challenges inherent with working with the government and having to change courses. Once you've been working for something so hard, something might change, at the top, and you have to be flexible and pivot and start working on something else and not linger on what the work you had been doing. That's not lost. You can still use that. But those are some of the challenges I have with work that come to mind.
All right. Fair enough. Thanks for sharing that. And what's maybe one or two of your favorite things about being a public health service pharmacist?
I think one of my favorite things about being a pharmacist in public health is that you can really have a diverse career working with different agencies and in different capacities, other than your more traditional pharmacist roles. I knew I didn't want to be a retail pharmacist. And so this path gave me the opportunities to do something different. And like I was saying about deployments, just depending on which agency you work for, you can get pulled into some really interesting projects and missions, and you can have such a huge impact on the nation's health, even working from your desk. And so I think that's one of my favorite things about being a public health service pharmacist.
Thanks for sharing that. I can tell that you love it, and I'm excited for you to finish up the next 3 years, and then I will call you out of the blue and ask, hey, what's next?
Please do.
Yeah, it's just exciting. You've got all these different experiences and all these different backgrounds now, and the world's your oyster. You've got great experiences.
Thank you.
You're welcome. Well, I just want to say I appreciate you being on the podcast today to share how you use your voice as a public health pharmacist. And is there anything else you'd like to add as we wrap this up?
I'll also add a favorite thing about being a pharmacist and the job that I have in public health is that somehow I'm able to do some of the things I love on the outside as well, being involved in certain hobbies. I'm fortunate to have some time to do that, and I'm not always because of what I do, and I know other people have different roles and jobs, I'm not exhausted at the end of the day, and I'm able to have that energy either with my family or some of my hobbies. So that makes me happy, outside of work as well.
Nice. I've got to ask, what's one of your favorite hobbies?
I have been really into improv comedy, and I've taken some classes, and they're so much fun. And I'm taking a class right now. I'm halfway through the course of a stand-up comedy as well. I'm just learning so much about communication and listening and saying yes and making ideas happen and being a part of the scene, so to speak, and also just learning basic communication rules, like rules of three. I just learned in my last class this past Monday, we had to present 2 minutes of stand-up material. My feedback was to remember rules of three. You have to tell them what you're going to tell them, and then remind them, tell them again. That not only works for comedy, but it works in your life as well to be a better communicator. So those are the things I'm up to, and I love it. And I'm not switching professions to become a comedian, but I do. That's one of the things I enjoy the most with my free time that I have.
That's awesome. Thank you for sharing that. I've had some improv comedy training as well. And like you just said, saying yes is part of that. And part of what you do as a pharmacist is you say yes to these deployments and these changes in scenery and location. So I think it's serving you well in your professional career too, if I may say so.
Thank you. I agree.
Yeah. Awesome. Well, thank you again for being on the Pharmacist Voice podcast. You take care.
Thank you, Kim.
Thanks again to Dr. Marisol Martinez for joining me for an interview here on the Pharmacist Voice podcast. I'd like to share some final thoughts with you. This is my 4th ever interview with a public health service commissioned core pharmacist, and it won't be my last. I find their roles fascinating, and I really enjoy our interviews. Now, this one with CAPT Martinez was about going from pharmacy school to the CDC. You heard about her story. It's pretty cool. Pharmacists and pharmacy students need to hear what's out there other than traditional hospital and retail roles and how pharmacists get into those roles. CAPT Martinez is one of a kind. She's using her clinical skills as a pharmacist at the CDC. She's using the pharmacist skills and then some. And it's really interesting to hear about. What I also enjoyed hearing about is a non-traditional family dynamic that works. It's refreshing to hear about stay-at-home husbands, hybrid homeschool programs, and a pharmacist who has enough energy to enjoy her hobbies at the end of the day. CAPT Martinez is a role model for pharmacy students and pharmacists who need to hear about family dynamics that work and jobs that don't cause burnout. I hope CAPT Martinez has inspired you to seek a career path that you love and a family situation that works for you. Everybody's different. I am so happy for her that she found something that works for her family. Now, if you're interested after hearing this interview in the Public Health Service Commissioned Core, I want you to visit USPHS.gov, USPHS.gov, or get in touch with CAPT Martinez. You'll find her email address and a link to the Public Health Service Commissioned Core in the show notes today. You can find the show notes on thepharmacistvoice.com. Just go to the podcast tab and then search for episode 209. Now, if you know someone who needs to hear this episode, maybe they're interested in public health, I want you to please share this with them. And if you like this podcast, please subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. I'll be back next week with a solo episode. What's the topic? I'll be talking about important audio engineering skills for pharmacist podcasters. If you need to edit audio, maybe you're thinking about starting a podcast or you make online courses, you'll want to catch this one. That's all I've got for you today. I'll talk to you next week.